I'm Dr. Daniel Markmann. This is our second episode of Metamorphosis.
I believe that Dr. Markmann wanted to walk a mile in my shoes. One of the main questions that he asks is, why do you want to do the surgery? And then he'll go from there. You know, if he thinks that you're doing it for other reasons, he'll even speak about that and why he thinks that that's not necessarily a good thing, if it's not a good thing. Because he said you shouldn't be doing this for someone else. You should be doing it for you.
He took time with me. He didn't push me in and push me out. He took the time. He wanted to know what I wanted. And at that point, all I wanted to be was normal. And it's taken a long time to get back to being normal, but I am normal. As of now, I look great.
Walk a mile in their shoes.
My name is Jose Santiago. I just moved here recently from Las Vegas in October. I'm a Southwest flight attendant and I came here for work. So I did this procedure more for myself because I wasn't feeling good in my own skin. So I did a lot of research and I did a lot of self-reflection before I decided to do this. So every time I took my shirt off, I didn't like what I saw in the mirror. And it was always like, you know, grabbing at my love handles or just like wishing I could do something better. Working out wasn't doing it. I had several personal trainers. I did meal plans, like anything that you can think of in the book, and it was just not going away. So instead I started looking at certain doctors that could help me, because that was the only thing that I can think of that would get me to a place where I would finally feel happy back in my own skin. So therefore, I did a lot of research. There's actually an app called Self-Help, and it rates doctors on how good they are performance-wise. So I downloaded that app, and then before I downloaded the app, I did a lot of research on different doctors in the area. So Dr. Markmann came up as 4.5 to 5 stars. So I was like, okay. So then I went from what he went on there to the Self-Help app, and that app came up with nothing but positive comments. So I didn't need to look any further, and I went on there and I did what I had to do and read the comments from top to bottom, and I was like, and there was like, you know, of course everybody's gonna have one or two negative, but it was very, very rare that he had anything negative. So I was like, there's say no more, look no more, and did my first phone call to him to do my consultation. I believe it was in December. So in December, I had my consultation with him, and when you first come in, he makes you feel very, very comfortable. You know, and he doesn't make you feel like, you know, oh, you know, he's grabbing at you, but he's grabbing at you because this is what he wants to do to help you. So that's the most positive thing to do. So when you take your shirt off, he's like, okay, this is what you like, this is what you like. And it's like, yeah, that's exactly what I want. So it makes you feel good because you're like, okay, someone else understands what I'm going through. So it's just like, okay, he knows exactly what I'm looking at, he knows exactly what I want. You don't feel uncomfortable at all. So it's like an amazing feeling when someone knows exactly what you want, and then they give you a little something extra at the same time. We did our analysis, so he marked me up here, he marked me up there, he showed me what I wanted, he said, this is what we can do for you. And I was like, sold to the highest bidder, and that was me. So therefore, we did everything we needed to do. Day of surgery came, he asked me again. Dr. Markmann is very good with saying, okay, this is what you want, right? This is what we're doing. And you have to make sure you know what you want when you go in there. Because at the end of the day, it's your body. It's nobody else's body, and this is all for you. You're not doing it for, TV. You're not doing it for someone else. You want to make sure that you're doing this for yourself more than anything. So we went in, and he circled all the spots, and I said, yes, sir, this is everything that we talked about and more. And I felt confident going in there. And then when coming out, you're after surgery, you're just kind of groggy from all the drugs, but that's it, it's what it is. 2 weeks later, you come see him, you see the results, there, you're still swollen, so it's kind of like, oh, it looks all right. So, but he's always like, don't worry about it, don't worry about it. And as a person, you're always going to worry about something that you do to yourself, especially if it's something to help you look better, make you feel good about yourself. So what we did is we came back 3 weeks later, and I had a full body garment. The body garment had foam underneath it. That foam is to help shape you for your six-pack or your abs or whatever else you're getting done. I was able finally to take those out. It was the best feeling in the world because it is a process to put on every time after you shower. But I will say that once I was able to take that off, it felt amazing. To just look in the mirror and see what you've done and what he's helped you get to, it is the best feeling you can ever feel. And then as things start to shrink and start to place themselves to where they need to go, you have this feeling of invincibility. You can wear whatever you want at this point. Just make sure you maintain everything, and you take care of yourself. You follow his instructions. That's the most important thing. Follow your surgeon's instructions, because if you don't, you don't want to bear off and get bad results, because that's how you get bad results. So you follow his instructions to the T, you'll be good to go.
Just wanted to go through a few issues with what's happening today with the coronavirus. As many of you know, our ability to do cosmetic surgery has been shut down due to corona. All the operating rooms as well as all the surgery centers have canceled any elective surgery. So in the meantime, we are still doing consultations. We're doing virtual consultations. So we are doing Skype and Zoom and FaceTime consultations with patients. We've got many patients lining up for surgery already and putting down deposits. So we're going to continue doing virtual consultations for anybody new who would like to get things set up. So when the time comes that the operating rooms are available, we can get you in and get things going right away. Hello.
Hi.
This is Dr. Markmann. How you doing? All right. Now I can. Now I see you and hear you. That's good. And you are Letitia, correct?
Yes.
And what are you interested in?
I was trying to look into doing a tummy tuck or a lipo,
Okay.
but I wasn't exactly sure what's the correct. Well, I guess I don't want to say correct, but what would be the least painful and the least recovery time?
Well, the least painful definitely is liposuction.
Okay.
But it really comes down to which one you need. So you can't do a tummy tuck unless you need a tummy tuck. So if your skin of your belly is tight and smooth, you can't do a tummy tuck. So tummy tucks are done to tighten your skin, to remove excess skin, as well as to tighten the muscles underneath your skin. So most people that do tummy tucks are either women who have had a couple babies or men or women who have lost a lot of weight.
Okay.
If you're
I would have to do a lipo.
Just lipo, okay. If your skin,
I'm thinking.
if your skin is tight and smooth, yes.
I have, yeah, I guess. I more have like a kangaroo pouch. I only have one son. He's 19. Well, he's about to be 20. So that's what my problem area is, typically the lower part.
The lower abdomen? Okay. Well, I'll take a look at you and get a better idea.
Okay.
Any medical problems we need to know about?
No.
No? Ever been hospitalized for anything besides a baby?
Nope, I've never had surgery. That's why I'm so nervous.
Good. Okay. That's a good thing.
Right.
We like healthy people, so that's good. Any medications you're allergic to?
No.
No?
So how long is the recovery time for lipo?
Most people take off about a week.
That's not bad.
Yeah, if you're doing all the way around the waistline, usually it's about a week. If it's just a little pot belly, you can do that and be back to work in a day or two.
Okay. Well, I'm a lecturer, so we're doing remote studies for the rest of the semester and probably into the summer.
Right.
So I do have a problem with sitting still.
Okay.
So that's why I'm more like, the time of being off of work is not a problem. It's just me making myself sit there. Yeah.
Right. Well, we do want you to get up and move around a little bit, just not too much. So you just don't want to overdo things. So.
Okay.
All right. I mean, as far as, again, whether it's liposuction or tummy tuck, I would need to see your belly to see which one would be best for you. If you can, if you just want to pull up your shirt, let me take a look. So your upper belly looks great. Lower belly, you might have a little bit of loose skin there, but I think liposuction alone should be good for you. If you really want the tightest belly, then definitely I would do a mini tummy tuck.
Okay.
But I think liposuction alone is going to look great.
Okay, yeah, and that's what I was saying. Like, I still kind of wanted to look natural.
Okay.
I know a lot of people I've seen who've gotten it done. They've gotten their butt done and everything, and it kind of it like looks like you had work done.
Right.
So I'm pretty active. And I definitely follow a strict diet. Probably like 4 or 5 years ago, I was diagnosed with type 2 diabetic, but I reversed that status, and I just had lab work done again about 2 weeks ago, and everything is clear. My numbers are great.
Awesome.
And I literally try to move my body at least an hour a day. I really believe it could just be a hormonal thing that makes me keep fluctuating, because 2 months ago I was 185 and this month I'm back up to 200. So it's like, what is going on? So I got the bases down, but I figured, well, maybe if I can try to get a little, do this, and then that'll maybe be some more encouragement, because I'm like 40 and I'm like, I can't see myself keep doing these Billy Blake kicks at the age of 50. Like, I don't want to be working out this hard.
Well, it's good to be in good shape, but
yeah, I know you still have to do the necessary things to maintain, but I was like, this is an option. I'm nervous, but I'm willing to try it. So I was trying to see also, do you offer how does it work? Is there like a payment plan, or is it something where credit, or how does that work?
So there are several different options. Again, some people just pull out their credit card and use a credit card. We do offer financing. There are 2 companies that finance plastic surgery, so we use both of those. So if you need to finance part of it or all of it, they'll usually finance any kind of plastic surgery. Everybody wants to get stuff done. Yep, everybody wants it done before summertime, so we're kind of squeezing everybody in the last moment once things open up again. The nice thing about liposuction is it is permanent. So when we're doing liposuction, what most people don't realize is we're removing fat cells. So most people think of fat as what you see in food, like grease, oil, butter. That's fatty acids and triglycerides and cholesterol. That's what's inside of your fat cells. So when we're doing liposuction, we're not just sucking out that grease, we're sucking out your cells. The nice thing about fat cells is you don't make new fat cells.
Oh, wonderful.
The number of fat cells you have at the end of puberty is the same number you die with. So if you gain weight, you're not making more fat cells. What's happening, all your fat cells are getting bigger. If you're losing weight, they're all shrinking. They don't go away. They don't move around your body, so wherever they are is where they are for your entire life.
That was the question I was going to ask. I was like, so does that mean it shifts? Like it'll roll more to my hips? If
you gain weight. So again, the most common rumor about liposuction is the fat just comes back elsewhere. The fat does not come back elsewhere.
I can use it in my booty.
Well, we transfer it there all the time. So if that's what you want to do, that's another surgery we do. But yeah, so once those fat cells are gone, they're gone forever. Okay, so wherever we take them from, you're permanently smaller at any given weight. Again, as I started to say, the most common rumor about liposuction is the fat comes back elsewhere. It does not come back elsewhere, but if you gain weight and we took off the fat cells around your waistline, you're not going to gain much around your waistline. It's going to go someplace else. But that's only if you gain weight. So the most important thing, if you want to maintain the results, is just maintain your weight and stays that way forever.
All right, wonderful.
Okay.
I'm excited. I've already seen like 3 pictures from a client that I have. I'm also self-employed too, so she sent me pictures of some of her friends, and I'm like, yes. Okay, wonderful.
So if you want to tune in,
I appreciate your time.
You're very welcome. Thank you. Nice meeting you, and I'll have Grace contact you in a little while.
Okay.
All right. Take care. Bye-bye.
Hi everyone, it's Brittany from Metamorphosis Plastic Surgery. I'm the nurse practitioner here. I run Dr. Markmann's medical spa, and I'm really excited to announce that we are actually doing virtual visits now. So if you would like to see us or have a consult, I know everyone has a lot of time at home right now, and it's the perfect time to take care of yourself as well. So if you've ever had those dying questions about skincare, injectables, and when I say injectables, that's Botox or neurotoxins, and then dermal filler, chemical peels, lasers, the list goes on and on and on. I'm here and I can answer any of your questions, and we can do a virtual visit. So go ahead and call the office and we can make an appointment. And I hope everyone is staying safe right now. I know it's a really hard time and challenging time for everyone, and we are trying to adapt as well. So I hope that this helps.
How you doing?
I'm good. How are you? It's really great to see you today.
Well, you know, all this time kind of stuck at home, and I'm kind of stuck staring at myself a lot more than I probably would like to. And
yes.
I'm starting to see some lines, some creases, and I'm only like 35, so I don't know what sort of procedures you guys would recommend to help with that sort of thing.
Yeah, we have a lot of different options. So it sounds like you are interested in some of our anti-aging options. Is that correct?
Yeah, I guess that would be it, yeah.
Okay, great. So we have neurotoxins, which a lot of people know as Botox, and we also have some dermal fillers, which is that we have a bunch of different brands, but that helps with the volume in the face. So is there anything in particular that is bothering you? And then that can kind of help me steer which treatment plan is best for you.
Well, I've noticed I'm a very expressive person, and I think my face is starting to show that. I have like a crease in between my eyebrows that's starting to get deeper. And then I also have like a couple like smile lines starting to kind of try to take root in my face.
Yes. So that is probably one of the most, two of the most common complaints actually, are the 11s right here and the smile lines around your face. So that's actually two different products that we would use. So for the 11s, that's where we would use the neurotoxins. And the neurotoxins are great. They help with just relaxing the wrinkles. Most people know it as Botox. There's also, we carry different brands such as Dysport, Jeuveau, which is also known as Nutox. So we can just find what option works best for you. And then around the mouth, those are called the smile lines. And the reason that you get those is because you're actually losing volume up in your mid-face. So as we age, we lose a lot of our fat pads, and we also lose some, like even some bone as we age. So the skin starts to drop, gravity comes into play, and we start to see those smile lines, and some people even get some jowls, but you're not there. You look amazing.
No jowls just yet.
No, not yet.
I'm sure you can help me out when that time comes too.
I can. And we have a lot of different options as well for just prevention. I think 35 years old to 40 is a perfect time to start with any like microneedling. We have, it's a device called Morpheus 8, and it's microneedling with radio frequency, and that helps with prevention. So it helps with skin elasticity, helps promote collagen production, and it's perfect. And then the other thing is we have Face Tight. When you do start to get a little bit of the jowling, a lot of people, you know, they're not too happy about that. We can do some Face Tight as well. So that's an option too for preventative measures. But sounds like today you'd be more interested in talking about the Botox for the 11s and the dermal filler for the smile lines. Is that correct?
Yeah, I think so. Just basically trying to get ahead of the game, so I don't, like, I really don't want to do surgery. Like, I totally want to avoid that for as long as possible. So I was kind of hoping that you guys would have something like what you're talking about, which is perfect.
Yeah.
So right now, like, are you letting people kind of be put on a roster so that when you do open up, like, my name would already be there as the next appointment?
Yep. So right now we're making a list, and we can have somebody reach out to you as soon as we know more, and we make sure that everything's very safe, and we will call you and we can schedule an appointment at that time, and we can go from there. But today the virtual consult usually takes the longest. It takes the longest. So yeah, so we can see you in the office when all of this dies down a little bit.
Gotcha.
So the next step, I'll put you on a list. Grace, our office manager, she will help get you on the schedule for when we open again.
Okay, and could you just let me know about like the price, about what you're recommending to solve my problem?
Around the pricing, is that what you're asking?
Yeah.
Yes. So pricing really depends on, again, how many units and how many syringes. So I usually estimate for what you're looking for is around $300 to $400 for just the 11s, and
okay.
And then that lasts about 3 to 4 months, again, depending on your body and how you metabolize it. It can last a little bit longer. It also can, if you're a runner or like marathon runners, I feel like they go through it a lot quicker, so maybe 2 to 3 months. And then as far as the dermal filler, those last about a year, sometimes even more. It helps stimulate collagen production as well.
Cool. Okay.
Yes.
All right. Yeah. Well, that's wonderful, and that's definitely a lot more affordable than going under the knife.
Yes, and very, very little downtime before your appointment. And if we do get you on the schedule, I'll have you just stop all your blood, any type of blood thinners. So either an aspirin, any NSAIDs, which is your Aleve, ibuprofen, anything that really thins your blood, vitamin E, omega-3s, and if it's okay by your primary care doctor to stop any of those, you know, if the aspirin's prescribed, if you get the clearance to stop those, we'd rather have you stop those around 5 days before seeing us in the office.
Okay. But yes, please put me in touch with Grace. I would like to be put on the list to be contacted, and then whenever all this craziness slows down in the world, then I look forward to you making me feel good about what I see in the mirror.
That sounds good, and I hope that you stay safe with your family, and definitely remember to take care of yourself through this hard time.
Thank you, and you too.
Yes, you're welcome. So I'll see you soon.